Okay, well, good evening, everyone. Thank you so much for joining us today on our orientation webinar for international nurses. I have a pleasure of introducing Maria Suvakarav, and I'm going to ask you to correct me if I was wrong on that, Maria.
Suvacharov.
Okay, Suvakarja. I'm trying to use my best accent. So Maria, thank you for joining. Maria is the Chief Nurse Executive at Resilience Healthcare, and she is responsible for Weiss Memorial and West Suburban Hospital. We have been just excited to work with Maria and to work with the leaders from her hospitals to interview nurses, and boy, we've got some excited people who are looking forward to going to your hospital. So with that, I'm going to turn it over to you and ask you to give us all things wonderful about your community and your healthcare delivery.
Okay, one
So
second.
welcome.
Allow me to translate. Buenas noches a todos.
Boa noite, galera. Tem a oportunidade de apresentar e temos o prazer de apresentar esta noite a Maria. Maria, que é a presidenta, é a presidenta de enfermagem do hospital que esta noite vai falar sobre o trabalho no hospital nos Estados Unidos. Então, vocês podem perguntar para ela, podem fazer perguntas para ela e ela vai responder algumas suas perguntas.
Some of you heard me say that I came here 33 years ago. I'm originally from Macedonia. I came here after I finished my high school and I finished my nursing education in the United States.
María nos saluda. Ella
María nos está viendo y que ela foi para os Estados Unidos e ela é de Macedônia. E ela chegou nos Estados Unidos para começar sua educação em enfermagem.
I was really just me and my husband, but this country has been really wonderful to us. And, I'm where I am and my husband is successful in his business as well. I don't think any other country would have given me that opportunity as the United States has done for me.
Ella les comenta que ella llegó a los Estados Unidos.
Está falando que ela chegou nos Estados Unidos, duas malas na sua mão. E então ela foi bem recebida nos Estados Unidos. Ela e seu marido. E então ela teve muita oportunidade quando chegar nos Estados Unidos.
But I also know that, I know that the nurses that we hire and we sponsor and we, we help come to the United States. I know that that we are earning their loyalty, and that means a lot to me.
Ella, habiendo participado en el proceso migratorio de los Estados
Unidos. Ela
Unidos,
participou no processo migratório para os Estados Unidos. E ela sabe o que é o processo que a gente está começando agora. Então, uma das coisas que ela gostou muito e que é amigável o processo. Então, ela falou que o processo que ela fez é muito amigável com as empresas que ela fez.
Okay, let's see, share screen. I'm going to go with this. There we go. Can you see my screen? Share. There we go.
Yes, we can, Maria.
Okay, awesome. So Dr. Prasad Manoj, he is the CEO and owner of Resilience Health. He has been with the organization for almost a year. December 2nd will be a year. I have been with the organization for 2 years. November 15 will be my 2-year anniversary, and I love what I do. So we have, now let's see. There we go. Services that we offer at Wise Memorial Hospital, it's orthopedics. We have a joint replacement and sports medicine there. We have cardiology, general surgery. We have acute rehab unit, oncology, critical care, emergency, geriatric psych, and clinics, infusion clinic, radiation oncology, medicine, and wound clinic. The services that we offer, go ahead,
Okay,
sorry.
Give me
I'll go
one
back.
second. Okay,
Yeah.
if you go back one more slide too, I'll appreciate.
Sure.
María estaba presentándonos a
María estaba presentando
dueño y propietario
o director e proprietário do hospital, que é o Dr. Manoj Prasad, que é o diretor principal do hospital. E a Maria é a vice-presidenta do hospital. E no hospital que ela trabalha, eles estão fornecendo os serviços de ortopédico, cardiologia, cirurgia geral, reabilitação, oncologia, cuidado crítico, primeiro socorro, emergência, pediatria. E também elas têm uma clínica de infução, radiação e oncologia. Também tem medicina e cuidado de heridas.
diagnóstico y tratamiento que incluyen infusión, radiación oncológica, medicina y manejo de heridas.
Services at West Suburban, very similar. Cancer oncology care, we have a big oncology clinic, diagnostic imaging, emergency, heart and vascular, orthopedics. Orthopedics are a little bit bigger at the Wise than it is here. We have rehab, senior health, but we also have women health and mother baby unit. So that's kind of a little bit different from what Wise has.
Okay. En el segundo hospital,
No segundo hospital que eles têm, eles também estão fornecendo os seguintes serviços, que está falando sobre oncologia, imunologia, emergência, primeiro socorro, também acessos vasculares, ortopédico, reabilitação e também cuidado de saúde, também saúde para a mulher e para a criança. Elas têm uma unidade.
para servicios obstétricos, de maternidad y unidad para neonatal.
So this is a very interesting little pamphlet that we received in the mail not too long ago. West Suburban has been around for over 100 years. This pamphlet is from 1918. This is an advertisement about the maternity ward at that time. And here's is actually, we have published the rate. How much does it cost per day for a ward bed or semi-private room, private rooms, for nursing care, specialty care, for everything. So we just thought this was a very just sweet kind of a thing too that we shared. Somebody shared this with us and then we shared it with our team, and we really treasure this because we truly are a community hospital that serves the neighborhood around us.
María nos está mostrando
María agora nos está mostrando
publicado hace más de 100 años
a propaganda que elas publicaram há mais de 100 anos. Ela está mostrando agora como era a propaganda publicitária para o hospital, onde eles davam a conhecer os preços os custos que tem para atendimento do paciente. Também ela está mostrando os custos para diferentes áreas. E para que vocês tenham conhecimento como era há mais ou menos 100 anos, quando elas forneciam estes serviços e custos.
Actually, I think we were doing a better job then than with right now, because right now in the States, we don't tell you how much it will cost you to come to a hospital. We need to do a better job nowadays. We need to go back to what we did 100 years ago.
María dice que hace 100 años hacíamos un mejor trabajo contándole a la gente que costaba.
María fala que há 100 anos elas faziam um melhor trabalho contando que elas forneciam coisas que agora ela disse que está tentando contar outra vez como há 100 anos a mesma propaganda
comunidades.
Yep.
para a comunidade.
Our mission to provide access to quality, individualized, compassionate care to everyone in the diverse and evolving communities we serve. I'm actually doing my doctorate of nursing practice right now. I have about 8 more credits to finish, so I'm finishing up. But one of the papers that I have to write right now is the diversity of the community that we serve. And I just did some research. About 70%, 74% of the population that we serve is African American at West Suburban, which is probably the highest, the most diverse population in Chicagoland. And that's what we pride ourselves at, to be able to serve the underserved, diverse population around us.
María les está mostrando a ustedes cuál es la
Agora ela
misión
está mostrando sua missão que ela tem na sua instituição, que ela falou sobre que elas, parte da sua missão que é fornecer o acesso de qualidade individualizada para o cuidado de paciente. E então ela contou que parte da missão que está toma conta as comunidades que elas estão fornecendo os serviços.
estudiando la característica de diversidad de su comunidad y la buena misión y las misiones que hay que hacer para poder servir a una población bastante diversa.
This is our vision. Our vision is to sustain the delivery of inclusive, individualist healthcare service with collaborative teams, ensuring the best quality outcomes. We do have residents in both hospitals, family medicine residents at West Suburban and internal medicine at Wise. We also get podiatry residents, and we will start getting surgical medical residents as well. We will serve with empathy and respect across all generations in a welcoming, supportive environment, and we will proudly continue to train clinicians of tomorrow to respond to the evolving healthcare needs of the community today, supported by an environment that values our diverse and dedicated workforce.
Okay. María nos comparte
Também Maria falou sobre a visão que elas têm no nosso hospital, que é manter uma visão onde eles estão incluindo e está individualizando o cuidado que eles estão fornecendo, e eles também colaboram com outras equipes para assegurar que a qualidade dos resultados seja ótima. E elas também falam que parte da sua visão que elas trabalham com empatia e respeito através de suas gerações para dar bem-vindos e apoiar o ambiente onde elas estão orgulhosamente continuando para dar treinamento para o personal de clínica, para que elas tenham as habilidades de cuidar a comunidade.
Probably the one that I'm the most excited about. Well, they're all really, the first 3 standard values, almost every hospital has that. You have to have compassion. You have to have integrity. Resilience is extremely important, especially with the pandemic and everything else going around us. But I love the enthusiasm part. And that's what I'm looking for people to show, that energy, enthusiasm. When I come to work, I spend more time with my coworkers than I do with my family. And if I'm not enthusiastic about what I do and the people around me, this will be a very sad life. So that's the quality I'm really looking for when I am interviewing people.
Okay. María nos comparte los
Agora
valores.
Maria está falando sobre os valores.
Ella dice que ustedes van a encontrar que en la mayoría de los hospitales
Ela fala que vocês vão encontrar na maioria dos hospitais esses valores que ela falou: resiliência, integridade, compaixão e entusiasmo, que elas são alguns valores que elas têm na maioria dos seus hospitais. Mas ela está muito interessada, uma das coisas que ela mais interessa é que a maioria das pessoas, quando estão trabalhando, tenham esses valores.
Una de las cosas más importantes y que ella está de lo más contenta sobre lo que ellos pueden demostrar es el entusiasmo de poder.
Uma das coisas que ela está mais contente como personal que trabalham no hospital têm eles são muito entusiastas e eles têm muito acercamento com os pacientes. Então, por isso que eles estão muito contentes com isso.
That are very important for us, for our hospitals. We have said this with our nursing team, and we make sure that we continuously focus on this and report where we are. But the very first one is patient experience. In the United States, patient experience is measured. It's mandated by the government that we do measure patient experience. So it's also a right thing to measure. How well are we doing this? How well are patients perceiving the care that we're providing? Then there's a CARIS, that's catheter-associated urinary tract infection, CLABSI, the central and associated bloodstream infection, C. diff, trach by day number 7. Those my ICU nurses will know this, that when patients are ventilated, we really want to put a tracheostomy in them by day number 7, and that's best practice. We are decreasing falls and falls with injuries, a big focus for us as well. Sepsis care, giving the antibiotics within 3 hours of admission, getting the blood culture before the antibiotics, VTE prophylaxis, that's a venous thrombolytic prophylaxis, and the length of stay. We're looking very closely at how long our patients are staying in the hospital. The reason for that is in the United States, the government pays you per diagnosis. So if a patient comes with a heart failure in the hospital, the government will give me 5 days of pay. Doesn't matter if the patient stays here 3 days or 20 days. That's all I get, just 5 days. So we can try to keep the patient right around those 5 days of length of stay, then we will come to positive zero. We don't make money. We just want to be zero at the end of the month, that whatever we paid out, that we get the money back. So those are some of the priorities that we are focusing on right now.
María les está mostrando.
Maria está mostrando agora algumas prioridades, como são as prioridades nos hospitais que ela trabalha nos Estados Unidos. Elas estão focalizadas nessas coisas que vocês estão olhando na tela. Então, ela fala que nos hospitais recebem pagamento por os serviços que eles fornecem para a comunidade. Então, ela falou sobre as prioridades que tem com o cuidado das sondas e cuidado com os catéteres.
Que los pacientes no se vayan a caer, no tengan ninguna caída, ni se vayan a tener ninguna.
Então, as prioridades que ela tem no hospital é o cuidado integral do paciente para a prevenção de eventos no hospital que ponham em risco o cuidado do paciente. Por isso que ela falou sobre essas prioridades que eles têm na maioria dos hospitais.
Buen manejo de los pacientes y que la duración de los pacientes en los hospitales, lo que se llama el tiempo.
E ela falou também sobre o período que um paciente fica no hospital e que o período de estáncia do paciente seja proporcional com o padecimento que o paciente tenha.
Just a little bit. I'm not going to go through all of the slides, but why is patient experience important? I have mentioned this a few times, a little bit about it already. But positive patient experience correlates positively to prevention disease management. Also, patients who have good patient experience adhere to the medical advices better, and at the end of the day, also will have better outcomes.
Ella no va a entrar en muchos.
Porque é importante a experiência do paciente. É importante porque a experiência dá para elas e ajuda para melhorar os serviços que elas têm, para dar uma melhor qualidade no serviço das diferentes áreas. Então, por isso ela falou sobre a experiência do paciente, que é importante a comunicação com o personal da saúde para ter melhor experiência e melhor qualidade no cuidado e o resultado seja positivo.
So, you know what? I am going to stop here and see if there's any questions. from me and maybe have a conversation. The rest of the slides really talk about patient experience, but maybe we can see if anybody has any questions for me.
Ok. María dice que en vez de darles toda una información sobre la experiencia de los pacientes y toda la parte del manejo, ella
Maria
más bien
fala que, que ela prefere falar sobre as experiências sobre os pacientes em lugar de que ela mostrar na tela as slides, ela prefere falar mais sobre as experiências dos pacientes, por isso que ela prefere mais que vocês façam umas perguntas para ela e ela vai responder.
Maria, while we wait for some of the questions, I think some of the questions that people like to know is, are you hiring in all the service areas in the hospitals, or you have some preferences?
Sure. So the only area where I really don't need much help is mother baby. Everybody wants to work there, and the surrounding hospitals are closing down their mother baby units, so they're consolidating more and more. So that's an area where I do not need help. My biggest need is emergency room and critical care.
Okay.
Because I have the most nurses in those two areas.
Okay. Yo le estaba preguntando.
Uma das perguntas que a Agnes fez é quais das áreas clínicas dos hospitais que eles têm, elas estão contratando. Então, ela falou que elas estão contratando todas as áreas, com exceção da maternidade. Então, ela falou que a única área que ela não tem oportunidade ou oferta do trabalho é na área de maternidade, mas ela falou que a maioria das ofertas laborais está em área de emergência, primeiros socorros. Então, que ela tem muitas ofertas do trabalho para você, se quiser trabalhar com alguns dos hospitais que ela está falando.
Psychiatry particularly, rehab not as much. Once again, that's an area where a lot of the nurses here want to be in. It's kind of a little bit of a slower paced, and it's not as demanding. So I don't need as many in rehab, but I definitely need nurses in behavioral health.
Ok. En las áreas, por ejemplo, como psiquiatría y rehabilitación.
Las áreas de psiquiatría también tienen oportunidades, también tienen necesidades de enfermeiros. Então, ela também tem ofertas laborais nessas áreas.
Based on the experience that the people have, you will make the decision what area you will recommend for the person. People will say to you, I have a lot of experience in critical care or in emergency department or in medicine. Will that be the best way that you will be making a decision to make an offer for one of those individuals?
So what we have been doing so far, Carrie and I kind of connect ahead. We review the resume together and we kind of make a decision. Okay, this appears to be good fit for this person. We kind of agree on it together based on the resume and the conversation that Carrie has had with the candidate.
Correct. So, Yamin pregunta.
Yamin preguntó que, de acordo à experiência, se a acordo à experiência vai ter mais oportunidade em uma área específica. Então, a Maria falou que ela revisa a trajetória profissional. Então, de acordo com a experiência laboral que o candidato tenha, eles vão dar oferta laboral.
The training and education that you will do or you do for a new nurse coming into your hospital?
Sure. So, if this is generally speaking, if this is a new grad that doesn't have any nursing experience, we will give them up to 12 weeks of orientation. Anybody coming in with experience, we will go from 6 weeks maybe to 8 weeks. It really depends. We want to make sure the nurses are set for success, and if they need additional week, fine, we'll give it to them. Or if they say I'm ready after week number, fine, that's fine as well. It's really not set in stone. It's something that the unit leader and the educator kind of keep an eye, meet with the new staff and make a decision together.
Ok. Normalmente la mayoría de las personas.
Normalmente, a maioria das pessoas
El programa de educación y entrenamiento para enfermeros que llegan
que
nuevos.
tem o programa de educação e treinamento,
Un programa bastante completo que dura.
elas estão fornecendo programa completo para que a pessoa que está transicionando para o hospital vai receber treinamento completo.
Ayuda y aprendizaje la persona tiene y está lista para continuar, ¿ok? I'm trying to read, and now I start to come a lot of questions, so allow me for a second. I'll read them, and I'll translate for you.
David, while you're checking on a couple things in my chat, I have somebody who is an operating room nurse that scrubs and circulates and also does robotics. And so the question is, can they use all of their skill sets because they worked hard to get those skill sets? Is that valued at Weiss or West Suburban? Scrub and circulate.
Absolutely. A while back, the United States, we went to separate the circulation, nurses would do circulation, and then we would hire scrub techs to do the scrubbing. But we're having a hard time finding scrub techs that are really good, I guess quality is the right word to say. And they're also very, their salary has gone significantly. And I'm like, well, why don't we just hire nurses to do both? So I think we're going in that direction. I think other hospitals are going that direction as well. So yes, absolutely. We do have a robotic surgery here at West Sub. Weiss does not. But definitely, scrubbing, circulating, and robotics is something that we can definitely use those nurses here.
Terrific. Thanks. Thank you.
Una enfermera preguntaba.
Uma enfermeira perguntou se ela tem experiência trabalhando na área de cirurgia e ela tem experiência trabalhando com equipo robótico. Então, a enfermeira perguntou se ela tem a oportunidade e a Maria falou que também eles têm ofertas laborais para esse tipo de enfermeiras que têm experiência com equipo robótico.
Somebody's asking me, they have just worked in general medical, surgical. Do you need them to have a specific specialization if they eventually want to move into some of the other areas, or you will help them train to some of the other areas? Somebody who has a lot of experience in medicine or surgery, I would like to eventually become a critical care nurse. Is that an opportunity that the hospital offers?
Yes, of course, transferring from one area to another, that's the beautiful thing about nursing. You can find exactly what fits you at the specific point of your life. So we definitely promote transferring to different areas. The general rule is you cannot transfer for 6 months. 6 months, you have to stay in the unit that you're hired for. And then if you are showing, interest and everything is working out fine, yes, we will allow transferring to different areas.
Entonces, la pregunta era,
Uma pergunta era que uma pessoa que tem experiência em áreas gerais, se essa pessoa quiser mudar para outra área, se tem oportunidade que essa pessoa tenha mais experiência em outras áreas. Então, se elas ajudam para essas pessoas que têm experiência em uma área e elas querem mudar para outra área, se elas ajudam com treinamento, a Maria falou que sim, que aquelas pessoas que têm uma experiência em outra área e que elas estão tentando mudar para outra área nova, elas vão ajudar muito com treinamento.
The hospital will become your sponsor to become a U.S. resident. That's part of what the hospital will offer. La pregunta que están haciendo es que si el hospital
Outra pergunta aí,
patrocinador para su residencia a los Estados Unidos, claro, eso es parte.
que se o hospital é o sponsor para ajudar para o processo migratório, para obter o visto e a residência, então elas falaram que sim, que o hospital vai ajudar nesse processo.
Here's an interesting question. Maria, in a long-term outlook, if somebody in particular wants to know if eventually they like to kind of follow your track and, or become a nurse practitioner, if that's something that the hospital will help them eventually pursue, becoming a doctor in nursing or becoming a nurse practitioner, is that something that's within the scope of the support that the hospital will provide the nurses?
Sure. So after a year of employment, you will become our employee. You're eligible for tuition reimbursement, and it's up to $5,000 a year. Doesn't cover everything, but still it covers fair amount of. That's normal, normal. That's the average what you would get for tuition reimbursement in any hospital. So I like to say when you're nursing, especially in the United States, you can go finish your BS. So I finished first my associate degree in nursing. That was 2 years. Hospital paid for that. Then they paid for my bachelor. Then they paid for my master. Then they paid for my FNP. Now, not many hospitals will pay for your DNP unless you make deal with them. And this hospital is paying for it because part of my offer letter, I guess I'm trying to say. But all the way to end of your master's degree, many hospitals will pay for it. Same with us.
Okay. Aquellos que están interesados en progresar su carrera, obviamente los hospitales.
Tem aqui as pessoas que estão interessadas em continuar crescendo profissionalmente no hospital. Lembrem que o hospital vai dar uma ajuda, mais ou menos $5.000 anualmente. Então, se você é enfermeira bacharel, você pode utilizar esse monto econômico para poder estudar um mestrado. A Maria fez um mestrado com a ajuda do hospital. Por isso que Maria fala que se vocês quiserem continuar estudando, vocês podem utilizar esse recurso que o hospital dá para os trabalhadores, que anualmente são $5.000, que vocês podem utilizar para estudar um mestrado, um curso, uma especialização. Então, ela fala que os hospitais ajudam muito para que você continue preparando, para continuar crescendo profissionalmente.
For nurse practitioners in the United States, and it's going to, and the outlook is looking very bright. There'll be more and more need for nurse practitioners in the U.S.
Okay. Y María les recuerda que
Então, Maria, lembra vocês que há muita oportunidade para enfermeiros com mestrado e que elas têm boas oportunidades e tem muita oportunidade para continuar especializando-se nas áreas que vocês quiseram. E então, vocês vão ter uma oportunidade do trabalho e crescimento laboral.
Maria, for people who has a little bit more of like a diagnostic and treatment area on your areas, like the for chemotherapies or I don't recall all the ones that you presented. Will you let them transfer after a while to some of those more, your cath labs, your diagnostic and treatment areas? Is that an area that they will be able to join, especially people who may have quite a bit of experience working on some of those diagnostic and treatment areas?
Yeah, of course, but critical care is really critical care anywhere. So I would not hesitate to somebody who has ICU experience in another country to come to ICU here. I don't have a problem with that. Emergency room is a little bit different, I think, just because there's a different rules and regulations and laws in the United States. So it's not that we have not I would be open to that idea as well. Cath lab also is very similar. You know, we have one of our residents, they're from India. So he is internal medicine resident and his wife is cath lab nurse from India. And yeah, I'll hire her in my cath lab, not a problem at all.
Ok. Para que la pregunta es, obviamente, si tú tienes experiencia en algunas áreas.
A pergunta foi que se vocês têm experiência em algumas áreas, como serviços de cardiologia, eles no início não tem problema para dar uma oferta laboral, mas elas têm oportunidades na área de emergência. Então, ela recomenda que você seja enfermeiro rotativo os primeiros meses. E depois, após vocês fiz rotatório, vocês podem selecionar a área que vocês quiseram trabalhar. Ela não tem problema para dar essa oportunidade, mas recomenda que primeiro seja enfermeiro rotativo.
Que entres a una reunión informativa. Maria, a person who has who's coming to you, who has a lot of experience in pediatrics ICU, but is coming to you to work on an ICU, you're going to receive her in an ICU?
Yes, I mean, many of the principles are the same, except that these are bigger people. You know, I remember I was orienting NICU nurse to work in the ICU, and one of the lines got disconnected, and there was little blood on the floor. She's like, "Oh, look at all this blood." I said, "Don't worry, there's so much more where it came from," because her mindset was set on NICU, little babies, and this was a big person. Just take that little adjustment, but should not be a problem.
Okay. Laura, los principios son básicamente los mismos. Te van a hacer la transferencia para trabajar directamente en la unidad de cuidados intensivos.
Uma pessoa perguntou que ela tem experiência no cuidado de unidade de cuidado crítico e se ela vai ter a mesma oportunidade para trabalhar nos Estados Unidos nessa área. Então, a Maria falou que não vai ter problema, mas tem que somente adaptar a situação e a experiência que ela tem para fazer uma transição para a nova área.
Para que puedan empezar a pagar sus procesos de especialización. Give me 1 second because some of the questions are coming in Portuguese, so I have to translate them first before I can translate them to you. Me gustaría saber si una ya mejorando esta ciudad aún hecho chance de entrar. Sibila, is an immigration question. I would have to answer her on a separate thing. Sibilia, pues tengo que ver bajo qué estado migratorio estás en los Estados Unidos. Raúl, por favor, contéstale en portugués que tenemos que ver bajo qué estado migratorio ya está en Estados Unidos.
Para a pessoa que perguntou sobre o processo migratório, o David falou que elas têm que analisar qual é o seu estado migratório nos Estados Unidos. Após analisar, ele vai dar uma resposta, né?
For somebody who eventually would like to become a CRNA, obviously they require their ICU experience. After that, the hospital, I believe that the question is they can use the tuition reimbursement to continue studying to become a CRNA.
You're not going to be able to work and go to CRNA school. CRNA school is a full-time. There's no work. You cannot count on working while you're in CRNA school.
Okay. Maria, I think there are some new programs that are now part-time.
Okay.
Yeah,
Yeah,
so
I mean,
yeah,
as
so
long
I
as it's
think-
up to a master's degree, we will cover. Yes, through
Okay.
master.
Yes. El hospital cubre todos los programas hasta una maestría y todos los
O
programas.
hospital cubre os programas de mestrado e alguns hospitais dão oportunidade de trabalhar tempo parcial, algumas não, tem que estar dedicado somente para o mestrado. Mas alguns hospitais dão oportunidade, mas não todos.
Surgical services, but you already answered that question, so I'm just going to let him know that you do have opportunities for people to work in the surgical area. Gonzalo, hay oportunidades con este sistema de hospitales para trabajar en el área de cirugía. Siempre especial en cuidados quirúrgicos, posibilidad de trabajar. There are people there's a lot of people asking me the same question over and over, that they are really interested to working for you in the area of critical care. So you already answered the question that no, you have lots of opportunities to work in critical care.
I'm critical care nurse myself. I'm a CVICU nurse, and I love critical care setting. I think that will always be my identity.
Okay. Este sistema hospitalario tiene muchas oportunidades en el área de cuidados intensivos.
O hospital tem muitas oportunidades para as áreas de crítico. Então, muitas pessoas estão perguntando, que está interessado de formar parte do hospital nessa área, exclusivamente, ou especificamente na área de cuidados intensivos críticos. E a Maria falou que elas têm oportunidades para ser contratados para essa área.
Para volverles a dar el panorama de trabajos que hay disponibles con este sistema hospitalario. I think that's all the questions. Let me see, I didn't miss anyone.
David, I wanted to make a comment.
Yeah, sure.
So Maria, I'm really interested to know how you develop such a great leadership team. And the reason I ask that is in interviews, I've been meeting with Jason from the emergency department, Maureen from critical care area, and many others. And one of the things that they really have been talking about is looking for people with that enthusiasm, people who are glad to come to work every day, who feel like this is a calling, that they really are there because they want to make good things happen for patients and families. And as your leaders are talking to the nurse candidates about that, they are just oozing enthusiasm and support and positive attitude. So what do you do to get these leaders that are just completely all in? Because I think that's one of the huge benefits of working in your system.
One of my biggest priorities is to develop my leaders. If they're not developed and if they're not able to carry the vision and mission that we have nothing. So I do, we are very intentional about the leadership development skills with my team, that they understand what's expected and that we are aligned. Jason is awesome. He's a young leader. He's actually calling me just now. I'm going to have to call him back and see what he needs. But understanding that there's certain expectations and we have to be all aligned with them, and meeting with them frequently, providing leadership development articles, assignments, different stuff like that. So getting them engaged.
Well, congratulations on doing that good work, because I can really see it, and so do the candidates. The candidates are like, wow, they have that interview, and when they're done, they're like, this is where I want to be. So,
awesome.
Good
awesome.
for you.
Thank you.
Carrie le preguntaba a María.
Carrie preguntó para María que ela tem desarrollado programas para formar líderes y ellos están reconocidos en Chicago y en ese tipo de programas que ela desarrolló para motivar a o personal de saúde. E então eles estão focalizados nessa preparação para o personal da saúde.
Los nuevos intereses y eso le ha ayudado mucho a crear uno de los mejores grupos de liderazgo.
Então ela tinha contribuído para formar um grupo de líderes, porque é parte do programa que ela desarrollou.
I don't think that's the case, but there is two people asking, are there any opportunities to go straight into ambulatory care?
I don't have many openings there, I'll be a little hesitant to do that.
Correct. We usually tell them that they need to at least
Yeah.
transition a year in the
Yeah.
inpatient care world before they can transition
Yeah.
into the outpatient world. But I just wanted to run that by you just in case.
Yeah. This is an investment for us. We're investing in the candidates and we need to be wise with our investment and we go in the areas where the need is the greatest.
Correcto. Okay. Normalmente, para las personas que están interesados eventualmente en trabajar.
Normalmente, para as pessoas que estão interessadas nas áreas de serviços ambulatórios,
quieren que tú transiciones por lo menos un par de años, 1 o 2 años en las
para as pessoas precisam de transicionar mais ou menos 1 ou 2 anos em nas outras áreas para transicionar nesse tipo de áreas. Então, elas vão fazer um investimento naqueles enfermeiros que têm experiência na área assistencial. Mas também tem oportunidades para as pessoas que estão tentando o serviço ambulatório, mas não é o primeiro que elas recomendam.
Same as they are for staff that just are from the United States, or are they different? I know the answer to that, but I'll let you answer it.
Yeah. No, we hire you and you're our staff, and the same rules and regulations that apply to everybody apply to you. For first of all, because that's the right thing to do, and second of all, will be illegal for me to do anything else.
Right. So
yeah.
Thank you.
We prefer that you work for us versus for some other agency and then working with us.
Yeah. Carrie, I'm sorry, I was answering a person.
The same benefits for vacation and holiday, and do the nurses that come through this sponsorship program, do they receive all the same benefits and salaries and everything?
La pregunta que le hacía a María es...
Y la pregunta que hice para María, que todos los enfermeros internacionais que vai receber os benefícios como que todos os enfermeiros que trabalham no Hospital dos Estados Unidos, os enfermeiros internacionais vão receber os mesmos benefícios, salário, dias de folga. Então, vocês vão receber os mesmos benefícios.
¿Hay alguna otra pregunta? Creo que ya hemos contestado a Sibila. I will have to talk to you offline about your immigration issue. I'll be happy to do that. ¿Alguien tiene alguna otra pregunta? I think they cover one second, there are a few more. As long as you get experience those. They want to know, obviously, salaries in the United States get adjusted based on your years of experience. As soon as you're acquiring more experience, your salaries changes year to year, is what somebody's asking, Maria.
Yes, generally speaking, that is the case. You know, we have a starting salary for new grads that everybody starts at that rate, and then we slowly go up. And there's a periodical salary increases. We just did nursing salary increases the last year for all the nurses. We try to have that every year, depending on what's happening with the hospital, but there's a periodic salary increases for sure. There's always opportunity for overtime. There's always opportunity for picking up extra. Anything that's work over 40 hours a week is time and a half. And you can get as many hours as you want, more or less.
Okay. Obviamente, anualmente hay ajustes salariales.
Essa perguntou sobre o salário anualmente. E a Maria falou que o salário está de acordo com a experiência do enfermeiro.
Siempre hay oportunidades para aquellos que están interesados en coger algunos turnos extras.
Então, sempre eles vão dar oportunidade para aquelas pessoas que estão interessadas em trabalhar tempo extra, elas vão pagar esses tempos e vai dar um bônus extra por trabalhar tempo extra.
Ana, los contratos no tienen límites, los contratos no tienen expiración. Tu compromiso con el hospital es un mínimo de 3 años, pero el hospital, los contratos son indefinidos, no se acaban a los 3 años. Okay, so somebody's asking, they would love to see, will it be possible to schedule to always work 36 hours, 3 days in a row all the time? And obviously after that, they would like to see if they can get additional hours. If that's a common way to do, but I'll let you answer, but
Sure.
Maria, somebody
So,
would like to say they
there's
would like
some
to work.
rules. There's some rules around scheduling. We do ask that you work every other weekend. And besides that, what other days you work, it really, doesn't matter to us. If you want to do 3 in a row, that's fine. Do Friday, Saturday, Sunday, that's fine, not a problem. But the weekends are the mandatory ones that we really need coverage for, because as you can imagine, everybody wants their weekends off. So we have to make those rules in place. But which other days you work, it's flexible.
Okay. El horario de trabajo es bastante flexible.
O horário de trabalho é muito flexível. A maioria dos hospitais tem esse sistema de trabalho que vocês têm que fazer um rotatório cada fim de semana. E assim, que vocês têm que coordenar os horários com seu chefe, mas eles dão muita oportunidade para que vocês organizem seu horário do trabalho. Eles são muito flexíveis.
Very good. I don't think I have any other questions right now. Carrie, anything that you have received?
I did just get a question from somebody saying, for the 3 years that they'll be working, where they are, that's a requirement, can they work past the 3 years? And could they, if they get started on, if you need help on day shift, 6 months into it or 8 months into it, would they be allowed to stay in the same unit but work a different shift if there was one available?
Yeah,
so those two questions.
We hope you stay with us 30 years, actually. That is our hope. And yes, of course, changing shifts is always an option depending what the unit needs. Right now, most of my needs are on the night shift. That's why we're heavily hiring for the night shift. I have some day shift openings as well. I don't see anytime soon where I will not have day shift open, So really, it's based on the needs of the unit. And if you talk with the director and say, hey, I really want to work days and there's an opening, that's not a problem.
Okay, great. Thank you.
La pregunta que hacían
la pregunta fue,
en general, muchas de nocturnos, entre otras,
E geralmente a maioria das pessoas começa a trabalhar no horário noturno,
pero si una persona quiere, si hay un
mas
turno,
se uma pessoa quiser mudar do horário, se há um problema para mudar, se ela vai ter a oportunidade para mudar do horário, a maioria das enfermeiras está nos plantões da noite, e então elas têm oportunidade para mudar para outros horários. Então, o hospital, a Maria lembra que o hospital que você tem que ter um compromisso de trabalhar com o hospital por lo menos 3 anos. Então, a oferta laboral é permanente, mas o compromisso que o hospital está pedindo para os candidatos é ter o compromisso somente de trabalhar 3 anos, mas lembra que a oferta laboral é permanente. O compromisso somente é trabalhar 3 anos. Se você quiser mudar do hospital, você pode, após de 3 anos. Mas se vocês quiser trabalhar menos de 3 anos, você tem que dar de volta o investimento que o hospital vai fazer para levar vocês aos Estados Unidos. Por isso que o hospital vai dar oportunidade de trabalho permanente, mas eles vão pedir um compromisso pelo menos de 3 anos. Né?
No, the switching of shifts and the opportunities to eventually train to move to a different service if that's what they want. Okay. I think, Maria, we're about exhausting the questions. Let me see a couple more questions. Okay. Algunas personas me están haciendo preguntas sobre el proceso de cómo se hacen
Algumas
los
pessoas estão fazendo uma pergunta sobre o processo. Então, Davi vai deixar pelo chat os links para assistir a uma palestra informativa. Eu acho que o Davi deixou o link, mas eu acho que a minha colega Bíblia vai compartilhar com vocês os links para os brasileiros, que são de diferente hora.
María del hospital, si quieren conocer algo más del hospital. Okay.
Você tem uma outra pergunta para Maria, para conhecer mais, saber mais sobre os hospitais?
About maybe 4 or 5 people who would like to know how quickly I can interview with you. So
We're going to be busy tomorrow.
so I want you to know that there's some people already lining up to set up an interview to talk to you. Okay.
Sounds good. Sounds good.
Okay.
Looking forward to it.
Maria,
Okay.
they were waiting to meet with you. We've been
Mhm.
meeting with many people really talking about it. And I said, come on Wednesday night. You can meet Maria. You can see what I'm talking about. So thank you so much. I really appreciate your coming and sharing.
Yeah, thanks, Maria. Really
Thank you for
appreciate it.
inviting me. Thank you. Appreciate it. Have a good evening, everybody.
Muchas gracias a todos. Gracias a María por haber
Muito
venido.
obrigado. Obrigado para Maria, que ela assistiu. Há muitas pessoas que estão interessadas em formar parte do pessoal desse hospital de Maria. Então, Kerry vai estar atenta para aquelas que estão interessadas em formar parte desse hospital. Nós agradecemos sua assistência. Agora, Amanda vai falar.
There she is.
Hi. Okay. So for next week, we have OET coming to talk about their OET exam. And the following week, so that's November 8th, 8 de noviembre, and 15 de noviembre, we have our immigration attorney, abogado de inmigración.
Amanda nos dice que en las próximas 2 reuniones que tenemos, la próxima semana va a venir la compañía OIT, que es una de las compañías que da que da una de las pruebas de inglés que ustedes van a tomar. Vengan, aprovechen, ellos van a contar cómo es el examen de inglés que ellos dan, que está enfocado en enfermería, en qué consiste, en qué estados de los Estados Unidos aceptan el examen, etcétera, etcétera. Buena oportunidad para enterarse en más detalles de cómo funciona esa prueba de inglés. Y en 2 semanas, no se pierdan aquellos que tienen preguntas migratorias. Uno de nuestros abogados va a venir para que ustedes puedan hacerles preguntas migratorias directamente a ellos y aprovechar una charla directamente con los abogados. Maria, thank you very much. Did we lose Maria?
Yeah, I think she signed out.
Okay, so muchas gracias a todos. Los esperamos la próxima semana y para que vengan y conozcan. Y muchas gracias por haber entendido el seminario de esta noche.
Thank you, Raul. Thank you,
Thanks.
David.
Thanks, Raul. Bye.
Bye bye.
Okay, bye, everybody.